Hello, everyone, and welcome to episode 59 of the Pet Behavior Chat. So this is going to be a super practical episode, and I actually was inspired to record this episode by one of my patients, Zack. Some of you might have seen me post on social media about him, but basically, Zack is a super anxious boy. I've been working with Zack for a number of years. And we've made so many improvements to Zack's behavioral health. But the one thing that he really still struggles with massively are veterinary visits. And I wanted to chat you through how we actually managed his veterinary visit this year. And I want to give you a bit of a background story about what happened to him prior as well, and you know what we sort of needed to do to mitigate some of the circumstances that led up to his veterinary visit. So it's going to be, like I say, a super practical episode. I want to be really clear that every pre-visit pharmaceutical protocol needs to be tailored to the individual pet. And what I recommend or what I used for Zack on this occasion might not be suitable for other animals. And it's really, really important that you get either your own veterinarian or a veterinary behaviorist on board to discuss the different options, but also side effects, drug interactions, whatever else there might be for a particular pre-visit pharmaceutical protocol. So that's really, really important. So this is not a one size fits all. It's not a use this on any dog and you'll be fine sort of approach. This was really specifically tailored to Zack's needs. And it's, you know, I think that's just really important to mention because I don't want somebody to go off and replicate what we did and run into trouble. But also, one of the things I get asked most frequently about is how to handle a very, very fearful dog in the veterinary setting. And oftentimes those very, very fearful dogs then show their fear by being aggressive. And those dogs are then labeled as aggressive dogs or difficult to handle or, you know, all those sort of different terms. And what we're usually dealing with are prior poor experiences, as in Zack's case. I'm going to tell you about it all in a second. And an extreme fear that is really sort of fear for their lives and, you know, fear of being touched, fear of being handled, fear of being restrained, fear of being backed into a corner, and all those kinds of things. So, so that's why I thought I'd do this episode, because I think it's practical. I think it might help some of you out there, whether you're a doggy owner yourself or whether you're a vet or a vet nurse listening to this and you have a number of patients that are very, very difficult to handle and do need regular veterinary care, then, you know, this is definitely one approach. There are many, many other approaches. And I think probably the other thing to say is that this particular approach that I used for Zack, would probably be further down my list. I would usually try other pre-visit pharmaceutical combinations before reaching this point. But for Zack, this was definitely, you know, the point that we needed to get to. All right, let me give you a bit of background here. So Zack is a male neutered adolescent dog. No, he's not adolescent. He's adult now. So he's probably 5 or 6. He was adolescent when I started working with him. That's probably why that popped into my mind. So he's 5 or 6. He was a rescue from a shelter organization. And when his caregiver got him, he was already very much a fearful and anxious doggy. I think he'd had quite poor experiences in the sort of care facility, the rescue facility. And I think prior to getting there, he probably also had very, very poor experiences. So he was, in general, a pessimistic dog. He's very, very suspicious. He was very cautious of everything and extremely fearful. One of the most fearful dogs I think I've actually ever worked with. So over the years that I've been working with Zack's caregiver, we have made massive inroads into how Zack sort of experiences his everyday life, how he is at home. They actually moved to a different home a few years ago, which massively improved Zack's quality of life. It's a larger home, sort of more remote, not as many immediate triggers, away from sort of a more urban environment. So all those things already have made massive differences to Zack, together with regular behavior modification. So Zack has worked quite a bit with Ilsa, and obviously we've also, not obviously, but we have also used a psychopharmaceutical plan for Zack, which we've changed a few times. until we've sort of reached the right medication for him. However, one thing that was always really a struggle were veterinary visits. So anything where Zack needs to be approached, where we need to put hands on him, where he needs to be handled, he'd be very, very defensive. He's fast, he's strong, he kind of wriggles himself out of any sort of situation. He does wear a muzzle. That has been an ongoing process, but with his sort of very suspicious nature, that has been something that's been sort of on and off. He very easily forms negative associations towards anything, really. The muzzle being one thing for sure, although he can wear a muzzle and tolerate it well, which definitely is needed for things like veterinary visits. I think one of the things that is really crucial for Zack and for Zack's caregiver is the ability to be able to take him to a boarding facility. So they found a really great boarding facility where Zack feels very, very comfortable. And there are just occasions in Zack's caregiver's life where he does need to go to the boarding facility. So if his mom has family visiting, or if she has friends visiting the home, if she has periods where she's perhaps particularly occupied with work, then it can get quite difficult to have Zack in the home. And one really sort of good way of managing that is by taking him to a boarding facility for a few days, which he knows well. He knows all the people there. He is good with other dogs. He enjoys that kind of time out and playtime that he has in that period. It potentially does arouse him a little bit, which obviously we don't necessarily want. But from a management perspective, there has to be a way that Zack's caregiver can sometimes have him not be in the home so that she can manage some things at home. As I say, in particular, family staying, her parents come and stay for longer periods of time. If she has work being done in the home, if she has any friends come over, then usually Zack will go to the boarding facility. And of course, the boarding facility, as they absolutely should, require Zack's vaccines to be up to date every year. So that necessitates a veterinary visit at least every year. And obviously, we always also want to pre-plan for those, hopefully not needed, but emergency vet visits if they were to be necessary, if Zack were to get sick or injure himself. So we're always thinking about what happens if Zack does need to go to the vet, what happens if we do need to handle him, what happens if there's an emergency. And so over the years, we've tried different approaches. We've tried to do his vaccines in the home. That was also quite stressful for Zack. And we sort of then decided that actually us coming in and encroaching on his safe space at home probably wasn't the best idea. And then last year, we actually, for the first time, used Detomidine oral trans-mucosal gel for him. Now, Detomidine is different to dexmedetomidine, which you might know as Cilio gel. So it's different to Cilio gel. It's actually an equine sedation gel. So Detomidine is the active ingredient. Domoseden is the name that it's known by. And it's an oral transmucosal gel, as I mentioned. So it's a gel that needs to be applied to the dog's gums and or cheek mucosa, so the inside of the cheek, what we call the buccal mucosa, because it's absorbed through the mucosa, so through those kind of tissues in the gums and the cheek into the bloodstream, and it has a very good sedative effect. So Detomidine, just like medetomidine and dexmedetomidine, is an alpha-2 agonist. So it has sedative properties, but it also has some, I don't know if I'm going to call them anxiolytic properties, but anti-arousal properties. So anti sort of this hyperattentiveness that some of these fearful dogs can show in these situations. Now, how do we get from using an equine sedative gel to dogs? And is this not a bit of a cowboy act and a little bit dangerous? Well, actually, no, because my wonderful colleague, Dr. Marie Hopfensperger, who is also an American College Board certified veterinary behaviorist, in 2013, 2014, actually published a paper on using Detomidine or oral transmucosal gel in dogs. And she was actually, I think, the first person to really sort of publicize the use of this. And as I say, the first work that she did was in 2013, 2014. There was a pharmacokinetic study done in 2016. But then recently, in fact, just last year at our annual Veterinary Behavior Symposium conference, Marie Hopfensberger presented an updated dose guideline for Detomidine oral transmucosal gel. So it's definitely something that's in the literature. It's definitely something that's out there, and is something that has been used and is being used for dogs just like Zack, who are very, very fractious, nervous, anxious in the veterinary setting. So Dr. Hopfensberger actually works now at the same practice that my mentor, Teresa DePorter, works at. So I'm very, very lucky to have quite a direct connection to her. And I got in contact with her via email, and I sort of described Zack's case and asked, look, would Detomidine be an option for him? And we decided that yes, it would. And we went to putting together a protocol for him. Now, last year, we used the doses that were published in the 2013, 2014 studies, which is something like 3 to 3.5 milligrams per meter squared. And if you're a vet or listening to this, so it's milligrams per meter squared. So there's a different way of actually working out the dose range. And we used that dose on Zack last year. One of the problems we do have is actually applying the gel to him. So as I mentioned earlier, he's really suspicious with many, many things. So even his caregiver kind of trying to put something into his mouth is tricky. So we decided that she was going to wear gloves, protective gloves, and actually put the gel onto her fingers and try and rub it into his gums. And the way we did that was kind of by using play. She'd play kind of tug of war with him and see if she could sort of get some of the gel into his mouth whilst playing with him. But even that can be quite tricky. So that's one of the things from a cooperative care point of view that Ilse's been working with them on is, him tolerating having a finger put into his mouth, even things like toothbrushing, anything that's sort of handling his mouth, really in preparation for this particular event, for having to put a gel onto his gums or into his mouth. There are other ways that you can kind of accomplish this. You can use something really sticky like maple syrup, honey, peanut butter, and mix the gel into that with the hope that it will kind of cling to the gums a little bit before it's swallowed, again, to get that kind of effect through the gums. Because what we don't want the dog to do is to swallow the gel, because it doesn't go through the stomach. It actually gets absorbed into the bloodstream directly through those mucous membranes in the mouth. So we used that slightly lower dose last year, and Zack probably didn't get the full dose even of the lower dose. And he was probably sedate enough to get an intramuscular injection into him then, and to kind of then go forward with intramuscular sedation to be able to do what we needed to do, which was to give him a good physical exam. I think we did some x-rays last year as well. And he does have some early signs of hip dysplasia, and obviously to give him his vaccines, draw some blood, all the sort of routine healthcare procedures that we want to do for a dog of Zack's age and who is on a chronic medication, his psychopharmaceutical medication. And we just want to make sure that we keep on top of his physical health presentations, especially since he's a behavior patient as well. And we know how much physical health and behavioral health go hand in hand. So that was last year. So in the space between last year, actually, no, so Zack's caregiver last year came down to Abu Dhabi. She has a friend in Abu Dhabi that she was able to stay with and then come to the clinic the following day. So Zack's caregiver, they live about 3 hours away in the northern emirate of the UAE in Ras Al Khaimah. And so they traveled all the way down, stayed with a friend overnight, and then came to the clinic the following day. And we did everything that I've just sort of described. This year, things were looking a little bit different because the friend in Abu Dhabi had gotten a dog, and Zack's not particularly good with other dogs in his own space. So that's different from at the boarding facility or a space that he goes into. So it wasn't deemed possible that he could come back down to my clinic for the annual vaccinations. And the caregiver decided to take him to a local vet up in the Northern Emirate, and to see whether, the vaccines could be done there. And unfortunately, that was a very traumatic event for everybody involved. I think everybody, Zack, the caregiver, the vets, everybody, because Zack obviously wasn't able to tolerate any kind of handling. He actually slipped his collar. He got away. He was running around in the traffic. So it's a concern from a mental and emotional health point of view, but it's also a concern from a safety aspect, or from a safety point of view. So that was aborted, and we tried to then make a plan for her to be able to come down to Abu Dhabi to have the procedure done at my clinic with myself. The reason I think that it was attempted to do the vaccines at a different clinic was because they had lapsed, and of course the boarding facility wanted the vaccines to be done as soon as possible. So without sort of a better option to come down here and do the 3-hour drive, which is also a pretty stressful event for everybody, it was attempted to do the vaccines at the local vet, which sadly didn't work out. And and I think when we think about sort of Zack's experience of the world and of life, I think unfortunately that sort of put us a step backwards in terms of teaching him not to be fearful, or not to need to be fearful of certain situations. So yeah, it did put us a few steps backwards, unfortunately, and we then had to sort of come up with a plan B. And luckily the friend here in Abu Dhabi was so lovely that she said that she would actually put her dog, I don't know whether she put the dog into a boarding facility or had it stay with friends, so that Zack's caregiver and Zack could come down, spend the night, and then come to my clinic in the morning. And what we did this time around is we used the Detomidine gel again, but we used a completely different dose, which is the dose that was reported as an adjusted, much higher dose range at our veterinary behavior symposium last year. So again, I got in touch with Dr. Hopfensberger, and we decided that a dose range of between 8 and 10 milligrams per meter squared, so that was quite an increase from the 3.5 the previous year, would be a good idea. And that's what is being used regularly for sort of sedative pre-visit pharmaceutical protocols. So that's what we did. So I calculated the dose, and I let Zack's caregiver know how much to give. Again, using the same method, playing with him, trying to get it onto his gums. And again, she succeeded at giving him probably half of that dose. So when he came to the clinic, roughly an hour after giving that, he was quite sedate, but he was still very much conscious and very much alert. And so we did again top him up with an intramuscular injection to sedate him completely. And I think for Zack, this is probably going forwards going to be the best option for him. I think getting that level of chemical control over him is really important. And I think it just creates an experience where he does not have to be conscious and concerned about being touched, being handled, and we can safely and thoroughly do what we need to do. And so I topped him up with an intramuscular sedative, but he was so sedate at that point that giving the intramuscular injection really was not a traumatic experience at all for him. And, he very quickly then was sedated, and we were able to do everything, a full physical exam, again, a blood draw, all of the vaccines that he needed. We also decided that next year he was going to come in for a dental procedure. That's probably something that was going to be on the cards for him. And we were only able to sort of determine that by being able to physically examine him. So yeah, it was, a really, really good and very untraumatic for everybody sort of experience. He literally, we had him as the first patient in the morning. There were no other animals around at all. The clinic was very, very quiet. He walked in straight into the consult room. I drew up the intramuscular sedation. We gave him that. He was sedated really quickly. We did what we needed to do really quickly. We were able to be really thorough about his examination and make sure that we're able to preserve his physical health and keep on top of that. And then obviously, because detomidine is an alpha-2 agonist, we were able to reverse that sedation with atipamezole. And so as soon as I knew that everything was done, I reversed him. So I gave him the reversal agent, which is called atipamezole. And within literally between 5 and 10 minutes, he was back on his feet again. We let him exit the clinic through a side entrance. So again, he didn't see anybody. And he was able to hop into the back of the car on his own, and that was it. So it was a really, really successful use of the oral trans-mucosal gel. It means that the caregiver can prepare the animals ahead of time. Now, obviously, you want them to be quite close to the clinic when they do give them the oral trans-mucosal gel. So literally, they were only about 5 minutes away from the clinic. And I said to them, as soon as you have the gel on board, come straight to the clinic. And we'd had all of our sort of, ops room or prep room things prepared. So we had oxygen prepared. We had, the reversal agent was there in case we had any kind of adverse reactions to the gel. But it went so smoothly. And I wonder whether this is an option for some, definitely not all, but for some of these dogs that have such high intensity fear and arousal levels, especially around handling and being examined and having anything done to them, really, from a sort of a veterinary care point of view. I really liked the way that this worked for Zack. I was also very, very much prepared. I had been in contact with Dr. Hopfensberger via email. Again, I had all my doses calculated ahead of time, and I had a plan, BCD, depending on how sedate Zack was going to be when he came to me. I was kind of already expecting that the caregiver wouldn't have been able to give all of the calculated dose to him. So I was already anticipating that I would need to give him an intramuscular injection. I had my medications all there. I had doses calculated at different dose ranges already on a piece of paper, all written out. I had, the milligrams per meter squared. I had the milliliters. I knew exactly what I wanted to do depending on the level of sedation that I saw in Zack when he actually came to the clinic. And I think that's a really, really important piece as well, is that pre-preparation, is knowing exactly, what you want to achieve, and also knowing that it might not be perfect, and having backup plans. And probably one backup plan isn't enough. You need to have a plan B, C, D, and be able to implement those depending on what you see clinically. So that's very much still where that veterinary side, that clinical observation, where our experience and all those things come in. And obviously, being prepared for, needing to give oxygen and, potentially intubating and needing to reverse quickly, and so on and so forth. So yeah, being really prepared and being really well set up, I think, was a massive key here. And that's where my anesthesia background kicks in, obviously, a little bit as well, to kind of really be prepared for those different scenarios and anticipate what might happen and be prepared for what might happen. So I just want to give this as an example, because I get so many questions from colleagues about how to deal with some of these cases. And for me, this was such a beautiful event, a very hands-off, or as much hands-off as possible from my perspective. And, a lot of the preparation could be done outside of the veterinary clinic before Zack even came in. And I think that was really helpful. Obviously, you need to have a caregiver who's on board and who's understanding of everything. So you need to brief them well. And you also need to have a team that's on board with what you're doing. So I worked with one particular veterinary nurse in this instance. I briefed them the day before already. This is the plan. these are our plans, BCD, and this is what I need you to do in these circumstances. I don't want you to make eye contact with the dog. I don't want you to go anywhere near the dog unless I give you the okay to do so. So it's really a team effort. My front of house team was briefed that Zack was coming in. They knew exactly where to send him as soon as he came in. So it was kind of a beautifully orchestrated team effort. But I think, that's what's necessary in some of these cases. Anyway, that was Zack's story. If you want to read a little bit more about the doses that I used for the intramuscular injection, have a look on my Facebook group, the Pet Behavior Community. I'd actually did a post on Zack in there, and I talk about some of the doses that I use in there, in the comment section, actually, of that particular post. And I'm going to put into the show notes the links to the papers that Dr. Hopfensberger did in 2013, 2014, and the pharmacokinetics paper in 2016 for anybody that's interested. However, please be aware that those doses have been updated now to a much, much higher dose range. I think that's currently only a proceeding at the moment. I don't believe that has been published yet, but I will find proceedings if I can and also put them in the show notes. But if anybody has any questions, so I do offer vet-to-vet consultations, which are 30-minute consultations to kind of discuss exactly some of these protocols and ways of managing perhaps some of these patients. And for caregivers, I do also offer 30-minute medication second opinion consultations. So there are quite a few different options for how you can get some additional support for some of these trickier cases, whether they're your patients or whether they're your own pets. I'm always really happy to consult with other vets and work out a plan together that's going to be appropriate and beneficial for the patient and also the facility and the drugs that they might have at their disposal. So if that's something that you would like to do, I'm also going to put the link to the Trinity website in the show notes. And if you go onto the services page, you can find how to book a consultation with me, or you can email us or get in touch with us via our socials. Okay, I hope you enjoy this episode. I hope you found it useful. And just before we sign off, I just want to stress again that this has to be an individual patient approach. So the approach that I used for Zack there was, in my mind, a good approach for him, but it might not be the right approach for another patient. And, there might be a better way of working out a different protocol or approach for a different patient. So please don't use this as a blanket sort of protocol or a one-size-fits-all protocol. It does still need to be tailored to the individual. But I do want to give you an idea of what options we have out there, and that we absolutely do have options for some of these extremely fearful patients and how we can best deal with those guys and handle them in the veterinary setting. All right, I look forward to seeing you next week for episode 60. Bye for now.